Hello, I'm David Redfern, consultant orthopaedic surgeon, specialist in foot and ankle and co-creator of the Mika bunion operation. I also undertake a lot of minimally invasive lesser toe surgery and have published on this and teach worldwide these techniques. And I think arguably the minimally invasive techniques in the lesser toes 2 to 5, are even more of a revolution than they are in terms of the bunion and surgery associated with that. I think traditionally we've been quite limited with open surgery about how we can correct a lot of toe deformities, and because of that we haven't perhaps thought about the deformities in their entirety. We've tended to simplify them into hammer and claw deformities, which is really thinking about it in one plane. The reality is most toe deformities are a problem in 3 dimensions. So in other words, if you imagine my finger being a toe, it's not just the fact that it's flexed, it's often deviated to one side or the other. It might be crossing the next door neighbour, underriding or overriding. And all of these factors are important to understand and bring into the equation in terms of thinking about the techniques to correct them. So what's new in the armamentarium with minimally invasive surgery is the ability, using these tiny little drills, to make little cuts within the bones, the little phalanges of the toes. And there's a lecture that I've uploaded onto the website that you can have a look at, which goes into more detail about this. But essentially here, this is the 5th toe, 4th, 3rd, 2nd, and they all have these little phalanges, these little bones within the toes, and we can make very careful directed cuts in these bones in different planes that allow different 3-dimensional corrections to occur, and the tendons then enact that through their pull.